Hey everyone, thanks for attending the first of 10 of the Non-Yalom group theory seminars. I'm gonna go ahead and jump in today. It's gonna be focused on mentalization-based group therapy. There'll be some attachment in that, but mostly mentalization-based group therapy for this first week. So I wanna just go over some things around the group theory seminar PowerPoint. There's a couple of primary sections that I'm going to try to highlight consistently throughout each of the theories that I present on. It's going to be a little bit of brief overview on the inception or history of the theory, some core concepts related to the theory and approach, differences that it has between the traditional interpersonal group therapy that we think of with Yalom, interventions that are used, maybe some traits that are embodied by the group leader, and core change factors that might be listed in the theoretical approach. Also kind of infused throughout this fabric, I'm going to work towards holding a social justice and anti-racist frame to try and infuse this throughout the content for that. Now, most of the slides material is taken from this book, which I highly recommend. It's pretty large, but really wonderful material. In addition to this primary text, I use the AGPA 75th anniversary article that's focused on mentalization's response to that article by Anthony Bateman and Peter Fonagy, as well as some additional citations that I placed throughout the slides that you can check out in the references. But the book, just so you know, it's more of a comprehensive overview of mentalization-based treatment for individuals, group therapy systems, and has some diagnostic specific adaptations for BPD, as well as antisocial personality disorder. Although the focus is on BPD, it's a very universally applicable theory. So it's used with tons of presenting concerns, and I find this kind of treatment has been extremely useful for me in my individual and group work. So I think it'll be really wonderful for you to adapt in different ways as well. One of the things that I want to name up front, and again, this goes along with the discussions I hope to have throughout this seminar, is group theories, like other individual psychotherapy modalities, tend to be based in a more white or Eurocentric origin, which means as you read the group theories, the articles, even this textbook, it tends to be very colorblind. They talk about clients and they don't provide any identifying characteristics, whether that be like things related to gender. I suppose you can try to infer that through the names that are given, or race, ethnicity, any kind of like spirituality or gender identities. Nothing's really expanded upon or talked about with an intersectional frame. So that kind of leaves us at a loss for a huge element that's constantly in the room with us. And that's that sociocultural context for your interventions or your use of the theories. So my hope is to create some examples as I talk through this presentation and the others that will help to integrate some of these various identities. So we can talk about the sociocultural transference that occurs. I think of it like, when we focus a lot on the way that family interactions occur and how people's parental figures or primary attachment figures have an impact on them. The other parent, I think, is the social cultural environment that we navigate, because that sends us all kinds of messages and things that tell us what it is that's acceptable and what is not, that can be internalized by each of us. So by incorporating that, I hope that we can, be curious about how this applies with your specific identities that come up in the groups, as well as highlighting, my own stimulus value, because I'll be talking about it from my frame of reference as a white, hetero, neurodivergent, cisgender male. And yeah, so that's my hope. And I imagine I will miss some opportunities of representation and potentially make some of my own transgressions. So I encourage any comments to my email to be able to assist me in enhancing my growth and hopefully make these products better for people to grow from. So I'm going to cover attachment very, very briefly. Obviously, you could do many different presentations on attachment altogether. But attachment theory, essentially that security that allows us to feel lovable or secure in relationships, to be able to explore the world and attuned to the world around us. Secure attachment often is considered key in being able to enhance curiosity, creativity, play with others, as well as just allow people to explore the environments in ways that could be risky or anxiety producing. So the primary attachment figures that we think about in the literature are parents, but can also be extended to community members, caregivers. There's some systematic reviews of non-Western cultures and how they fit or don't fit quite into the attachment and relationship patterns that we know from Ainsworth and Bowlby's research. And so it's very limited from what I've been able to read so far, but I think with that comes the idea of, Bowlby even actually talks about the intergenerational effects of attachment. And so I think it helps to be considerate of intergenerational trauma, whether that be racial trauma within the US or other cultural factors that could transfer insecure attachments. Because if you're not feeling safe by the environment, which it constantly reinforces messages that you're not wanted, then you're not going to be likely to want to question that, and you may adapt to that in different ways that may seem dysfunctional or ineffective, but is really productive for you and the way that you've had to adapt to the environment. So context-specific attachment figures can also be present. They've done some research on teachers and other kinds of primary figures like that, though I think it's more limited. But point being, we're going to focus on this from the space of when we adapt to things in life, we have attachments that can seem, again, some of the language here is a bit negative in terms of the connotation of an insecure attachment style, because the view would be that if I was raised in the same community or with the same parents or family system, I'd adapt to that same style. It's productive in a way, and so we'll talk about that briefly. We create these internal working models, Ainsworth and Bowlby kind of speak to. They say negative working models can be made when caretakers don't meet the needs of the infant, but if you're not going to get your needs met by an inattentive parent, then you may naturally want to take care of your needs in a different way. And so that might be doing things rather than staying with your emotions and staying with that distress. So again, just trying to think of that from a more positive frame reference instead of defective. So these continued effective and cognitive responses, they become kind of automatic models that we internalize as children, and they influence how our relationships, how we relate to others in our life. That makes sense in terms of we've adapted to getting our needs met before, and although the context is different, the undercurrent's the same. So in group therapy, this provides us a really wonderful opportunity. We can have a chance to see these internal attachment representations in the here and now of the group, and through mentalization can be able to even mentalize what's happening or what we think other people are viewing, how they're viewing us, why they're treating us the way that they're treating us, and kind of challenge those beliefs, while also enhancing and for me, highlighting the purposefulness of those internal representations within each member from their own social cultural context. So the attachment styles that we know, as far as the secure, preoccupied, dismissive, avoidant, and fearful avoidant, those are the four main types that we'll just cover a couple of them very briefly. So preoccupied attachment style, they describe as high anxiety, low avoidance. And again, with any of these kinds of labels, it's not a one size fits all, but something to kind of see a connection to certain patterns. So for people that feel are flooded with feelings, they seek out praise, they desire that and crave the caring from others, and can be self-critical, sensitive to abandonment and rejection. That can be something that would be considered preoccupied attachment style. As we go through this, I think it's helpful also for you to reflect on what parts of these represent you. And again, I think you could have parts from different parts of these styles, but you might have a primary attachment style that you connect with. Dismissive avoidant. That's the low on anxiety and high avoidance. So more self-reliant, minimizing dependency, and more of the doing things rather than feeling things. This certainly feels like something that I could connect with in terms of being able to cope with my emotional states. And yeah, more valuing the independence and achievement of things rather than dependency and vulnerability. So fearful avoidance is the high on anxiety, high avoidance, and that can be more chaotic, linked to trauma often within the literature, and very unstable because of that. So feeling hyperactivated and avoidant, concerned with safety, and dissociating from events to cope with the pain and distress. So things to keep in mind as we move forward with mentalization. So for some of the history of mentalization, it was initially created to treat borderline personality disorder and then adapted to different clinical contexts, like I mentioned before. MBT recommended that the social context for clients are stable. They highlight that stressors within a social environment, housing, financial, employment, probation, and other stressors can muddle the treatment's effectiveness. So I think, again, this can be implicated in terms of like, what's the current context of the US and what is a stable social context mean, especially in the middle of a pandemic, which we're currently in as I record this, and how even in the recent racial reckoning that's happened since last summer, where there's demonstrated media and violence against Black or African-American like members of society, that again can increase your epistemic vigilance or your lack of trust for the system or others within that like system. So again, like all these things I think can compile in terms of how they impact your attachment or willingness to attach to others. And with that, I think comes a really important purpose that you have as a leader, as a facilitator of these groups, to be able to name the sociocultural context within the group setting and highlight the isomorphy that, you know, the ills and woes of society will play out in the group. I don't want it to. I'm not going to purposefully say something racist or misogynistic or homophobic, but because all of these things within the system have been internalized in me, because that's part of navigating through these systems, covertly and overtly, those things can occur, and they will occur within members. And so the goal here with mentalization is really wonderful, and in terms of incorporating this, because we're just bringing curiosity to it. We don't actually have to know, and as we'll talk about the theory, you'll recognize it's less about knowing and more about opening up to the possibilities of what can be occurring and what can be influencing this. So that, I think, as a white male, is important for me to name up front. I think it's important for everybody, but especially if you hold majority identities, to be able to name that as soon as possible for your clients, so you can be seen that this is something in your consciousness. Running a dissertation support group previously, I had some international women of color like in that group who, well, many members commented to me later as the group was nearing its end to highlight the usefulness and the meaningfulness that some brief interactions at the beginning of group had on them. In the pre-group appointment, I give them that spiel that I talked about before in terms of group parallels that process. And so we'll have discussions about racism, misogyny. We'll bring curiosity to that. But they also mentioned that a few of the comments I had made early on, where I just made notice and brought curiosity that a white male member in the group had only connected with or talked to other white identified folks within the group. And that, again, is something where I don't see it as villainous, and I don't take it as a problem that we need to address, but showing that conscious awareness, I think, gives people some relief and recognition of you being cognizant of these elements in the room. And it's good to be explicit about that, as we'll find out in MBT. So the core concepts of MBT, some of them that we'll cover: epistemic trust, and that's just trust that you can trust the authenticity and the relevance of this knowledge that this person is giving to you in the social environment. I believe what you say because you seem trustworthy. Obviously, we all start with some mistrust, understandably. Like when we're meeting new people, we don't just fully trust whatever they say to us. So we have vigilance for that. But recognizing, again, like the social cultural context of what might lead to people needing to have that vigilance, and for you to be explicit about that, again, I think enables there to be trust earlier on. You want to be able to, as a leader, be authentic, transparent, and curious. That will allow trust, again, to be able to build over time. And within this group, we talk about creating a culture of inquiry about the mental states of yourself, your others, your emotions, your cognitions, the internal state, as well as your external states. So when we talk about increasing epistemic trust, there's a couple of different techniques they use. Eye contact being one, kind of hard to do on Zoom, but might be there someday. Turn taking, this contingent like reactivity to what you say, addressing somebody by name. So I always want people to talk to one another, and they'll do this pronoun game. You have to watch when people talk in group by speaking in third person to one another. Like when he said that earlier, I really felt connected to him, and the way that his family had treated him earlier, that spoke to me. I always try and say, who are you talking to, and can you talk to them? So they can use those you pronouns to be able to say things directly to one another. It really helps in terms of being able to acknowledge and produce more direct contact and affect in the room. So small, but a big thing to continue to be observant of, because it happens all the time in these spaces. And the last thing is the tone of voice. And you've maybe heard me doing it over the past couple of sentences, but it's kind of shifting your voice in a way that really heightens the tone. So almost as if you're talking to a child in some ways. We know how like parents will often talk to their child in very silly tones. And that's actually something that can really help heighten your attention and bring more interest to the moment as something to pay attention to, as opposed to just droning on and having the same monotone voice that you can start to have if you talk through a PowerPoint of this size. So when we talk about vigilance, that's again just the simple contrast to trust, where we don't trust everything people say because sometimes people can be ignorant or ill-intentioned. I don't actually necessarily agree with the ill-intentioned part. I think it depends on the context. They're always doing something that's trying to be adaptive, even if we don't agree with that intention. But acknowledging the responsibility that you have, again, as a clinician, to bring awareness to those problematic dynamics, discrimination, is going to be really important. Not to put all the responsibility on the members, the people of color in the group, or of marginalized identities, trans identity, just depends. But whatever it is, it's important for you to recognize and note yourself as a ally who wants to be conscious and aware of these things as they come up, so that it doesn't fall on them. Yeah, so when we're vigilant, we're closed off to further learning. We want to question the intentions of what people say they initially declared. And some things that usually lead to this are past traumas. Again, whether that's physical, emotional, verbal, sexual, or racial trauma, that's things within the system that can cause more of a distrust towards certain identities or certain relationships. So all vigilance, again, is a reasonable adaptation for that person. And it isn't problematic so much as it is that you just want to honor and bring awareness to it as it's happening. So as we kind of shift towards what's mentalization-based group therapy actually focus on, the purpose of it is to practice mentalizing the self and others while you're in a contained training space. It seems more like psychodynamic groups than modern analytic because there is more focus on interpersonal dynamics, outer states of mind. And the facilitator is focused on this active engagement within the group, very active at times, rather than kind of passively observing how the group deals with the situation. You're going to be tuned into the non-mentalizing or mentalizing patterns as they occur. There's an occasional shift to individual one-on-one focus in a way that's maybe contrasted to what you do in modern analytic or other processes that bridge a lot. but it's only for a time so that you can have like a narrative and understand where the gaps are in this person's mentalizing capacity. So if somebody, again, like similar to other techniques or modalities, we need some there and then narrative so that we can highlight the difficulties that this person is having in being curious about other people's intentions or feelings or minds. And then that way we can bring that into the room and have them practice that within the space with other people. So you want to actively promote a lot of group interaction and, again, be very explicit about these processes, making the implicit explicit in our minds. What does non-mentalizing behavior look like? This can be a lot of different forms, but essentially overly detailed descriptions of stories and narratives with no focus on emotions, thoughts, motivations, using stereotypes, generalizations of others, focusing on things you should do, shouldn't do, must, those kinds of beliefs, denying any involvement or in a problem or situation, fully externalizing blame or fault finding in others. Again, you can kind of see how these things can plant very well on the ideas of like DBT or working with folks from with borderline personality disorder. You want to notice if there's any excessive certainty about the thoughts, feelings, motivations of others, and be mindful that we also fall into these patterns all the time. And the goal is to identify your inner experiences, your emotions, your thoughts, to hold on to them, understand the narrative of these like experiences. Where is this coming from? What purpose did it serve? Honor that purposefulness, and then be able to express like the mentalization process. So if we're trying to talk about what mentalizing looks like in terms of its trajectory, often it starts out with our clients speaking about an event and talking about their experience at the time. So talking about their inner like emotions, thoughts, intentions during that process, reflecting on the event like in that way, talking about their feelings, and then the experience about what's it like to talk about that in therapy right now with me, and working towards alternate perspectives or increasing the curiosity of what's been present within this context. So I'll just give an example to try and make this more clear. In the dissertation grad student group, I'll just use that as another one. There's a woman from Venezuela who is speaking about her difficulties in being able to communicate with her professor openly, and fears about being seen in a certain light from that professor because of some of the ways in which he seemed to not be as considerate of her or prioritizing other students after her. And the ways in which she spoke about the event was finding a lot of personal faults and pointing a lot of the blame at maybe I'm too much, maybe I'm asking too much overbearing for the professor. So being able to speak to that experience and feeling like worried or disappointed that people think she's maybe too emotional or she's not professional enough within grad school, had us be able to, as a group, reflect on that event, reflect on her inner state, notice that it was very much like her affect, her feelings matched what she felt was happening in reality. Like feeling a sense of inadequacy was kind of what she felt was happening or what was true about that situation. But being able to reflect on that and having other members of international backgrounds be able to reflect their experience of what they thought may have been happening, brought into some of the context, like could this be something about the professor not taking you seriously as an international student? Could there be other elements where the professor is potentially overworked and busy and not cognizant of your needs since you're a newer student to him? And so there was a lot of discussions and generation that we were able to mentalize to be able to add some complexity to what her view was of herself or others and depersonalize that experience. So it's not necessarily like a space where you're trying to convince the other person that that is the case, but really validating like that experience by having the other members first speaking to like how they felt or how they imagined the member would be feeling about this, how they could imagine themselves feeling in that situation. So having that empathic validation so that she feels connected to and feels that they're able to connect similar situations in their lives with her experience of being forgotten or talked down to or what have you. Or even, again, all of them being grad students can relate to disappointment or feeling forgotten by their major professor at some point. So those factors kind of all assist in making that trust feel greater. Like I can take in what these people are saying, that they're coming from their authentic experiences. And that allows there to be more flexibility in terms of like what she's able to reflect on or maybe consider for what's happening in her situation herself. So when we're talking about that example that I just gave, that's speaking more to the psychic equivalence, which again is like what you think and feel is fact. That's real, true, and no other possibilities exist. I like this phrase that they use because they kind of speak, I think, in the 75th anniversary article that a lot of the problems come from an excessive amount of certainty. And I just really think that phrase fits it well. It's very affect driven and very much focuses on the inner world of our emotions as opposed to the external world around us and what could objectively be going on. So pretty common. And another pre-mentalizing mode that, again, the reason they call them pre-mentalizing modes is when we're younger as kids, they kind of say that we're not able to mentalize as of yet. And so pre-mentalizing is more common or basic approaches to navigating the world that we all have and we all slip into. Teleological mode is very concrete. And so if I can't see the intent behind what you say, I have to see concrete actions for you to prove it to me. So the more concrete and goal-directed actions, that's the thing that actually matters to me. Kind of the example that I would use is like handing a box of tissues actually shows that someone cares about you. Getting emotionally upset in the space. People saying that I care about you or I'm really sad hearing that doesn't impact you as much. So there's no real exploration of other people's states of minds, of intentions or perspective taking. It's a very extreme external focus on the world instead of any insight to the internal worlds of others. And pretend mode, this thing still feels pretty strange to me. Thoughts and feelings become separated from reality. So essentially there's some disconnect in what's being discussed and the affect that's associated with it, but not to an extent that I would imagine it means when you think of someone smiling when they're, kind of talking about very difficult traumatic content. This feels like it can be more about hyper intellectualization. And so somebody can speak very eloquently and in this cognitive realm. So it makes it seem like they're mentalizing, but they're not actually mentalizing. And how you can tell the difference is there seems to be some disconnect where it doesn't really connect with the affectual experience that you would expect them to have. There's a certain circularity to the way that they speak, or there's a meaninglessness to the content being shared. In the article of the 75th anniversary edition, they say the closest one to this would be, I think, Otto, who starts talking about, in the middle of a dialogue in the group, a conversation about work, like with his tickets at work, and saying we have these things called tickets, and why we call them tickets is because they're used for this. And it's completely out of left field and doesn't really pertain to the current conversation. So it's not an exact representation, but it's the closest I think that it represents in that example for it. The three communication systems that in mentalization-based group therapy that are worked to be achieved are kind of a stepwise progress that we're all working towards in this. The system one is basically the therapeutic alliance. You're kind of teaching the group and you're helping them learn content to help lower their epistemic vigilance. So explaining the benefit of mentalization, giving perspectives and recognizing the benefit of perspective taking, and focusing on the implicit and explicit parts of ourselves and parts of others so that we can not get bogged down with certainty. Communication system two, which is like a reemergence of robust mentalizing. And so there's an increased interest in both the therapist's mind or other clients, other members' minds and their use of thoughts and feelings that stimulates and strengthens the client's mentalization process. And system three is like the reemergence of social learning. So you're essentially starting to learn and gain skills within the group and mentalizing, and you're starting to use that outside. A way that I would reflect on this would be in one of my private practice groups, there's an older white male who identifies as gay and as often visits his mother. And she says very chiding and very jabbing, painful comments to him. Very, very hurtful and not necessarily related to his identity, but towards the aspect that he's not doing enough for her, or that he's not treating her as important. And so by us kind of talking through that in our individual sessions as well as in group, he was able to help try and foster his own mentalization skills. So he was able to put himself into the mind of his mother and considering the past that he understands about her, mentalize and say like, okay, what is it that maybe she is feeling right now, that what's her intent in doing this? What is she wanting me to do when she makes some passive aggressive comment on how I don't visit enough? That is in a way when it makes me feel inadequate or that I'm unloved, then he can kind of say like, okay, that feeling that she's pushing into me, that could be her feeling of not being loved or cared for. She hasn't felt that most of her life. And so the only way that she's been able to get that is to maybe cajole or to, kind of shout or pressure people to do that within her family system because of her own traumatic past. And now I recognize that this is her way. This feels like the only way that she can get her needs met is to make me feel this feeling of inferiority so that I take care of her, which was very sad. Like when we're able to mentalize and kind of see that state, we can see that this person is suffering in their own way. And it's not to excuse the impact that this has on you. The client is still angry and frustrated at his mother, but by being able to mentalize and gain that perspective, there was a way that he could take a step back from personalization of that stimuli. So he was able to catch that dagger that was being thrown before it impacted him and let it drop to the floor. And you could see the results as he continued to increase that skill within group and individual. He was able to visit without taking any of her comments or criticism seriously, recognizing that that's her way of communicating. So I like the way in which this can help make it not about you, because obviously when somebody's criticizing us, oftentimes the first thing that we do is think about how this must be my fault. If somebody's angry, it means they hate me, that means there's something that I need to reject about myself. And mentalization can really help in reducing that. So if you're going to set up a mentalization-based group, they have certain ways in which they structure the group. It's a bit different than an open-ended interpersonal group. In the pre-group appointments, you can typically focus on the attachment patterns and tendency or the general path towards mentalization, kind of highlighting what it is, what it's not, the kind of ways in which we fall out of it. provide a session summary so that at the beginning of every session, you're highlighting the content across time that happened in the last session. This is like a process note. And if you have a process observer, it can be really helpful. Again, there's so much to continuity between sessions. We'll have college students that come in each week. And if you just ask, like, what do people remember from last week? Where do we leave off? Which I've unfortunately done. Most of the time you get a sense of like, oh, I don't know, I'm just so tired. It's really busy this week. I haven't really thought about it. And that really grinds the group to slowed progress when you can take the time and effort for you as a clinician to highlight, well, I know we had this piece came up last week, a dynamic between these two members that seemed contentious that we weren't able to address. So I didn't want to let that go. And also we saw last week this person really open up and share some vulnerability around this topic. And this person gave a gift to the group of their identity that they hadn't spoken about openly before. Then that is something that shows like a sense of continued narrative. And there's something about that that's easier to jump back into for folks. So doing that, I think, as a practice is really wonderful, even if it's only a few sentences. You don't have to make it extensive. But then you do a brief check-in, go a round of problems. You want to be very structured in this, not let check-ins go too fast or too long, and then keep it contained in that way. Then you synthesize problems. If you see similar themes between problems or dilemmas, then you may share that as a shared theme that you can begin to unpack. The focus of the group, that may be known, like who you may already know who will start based on the intensity of that, or guided by the details that members give during the go around. And then you do the mentalization process. They do this for 75-minute groups. You obviously keep it at the regular 90 minutes. And then you close group, summarize the points learned, close the topics, and reflect on further areas to be addressed. So again, you're kind of like making that little notes for next time with this. And then after group, you can mentalize about how you mentalize. And you can do that with what we used to do is a, what do you call it? Process, post-process session or flash process, where the group members are present while you're speaking about the dynamics and mentalizing what you think might be going on with each of the members or with the dynamics that occurred in that space, which can be really helpful and interesting because clients, group members really love well, I say love, they're probably stressed out about it, but there's excitement and interest really in seeing the group leaders speak about the dynamics with one another in a colloquial or kind of informalized way about the process after group is done. And it does sometimes provide more stimulation for them when they come back to make note and highlight any of their frustrations or concerns about the post process. Oftentimes we say, we'll talk for the next 10, 15 minutes about the group, and you can stay if you want. If you do, we ask that you don't like speak or kind of like talk during it. And if you have any concerns, make a note of it so you can bring it up for next time. And obviously with the precaution that if anything feels extremely distressing, you can absolutely talk to us, but short of extreme distress or suicidal thoughts or things like that, then we ask that you hold it for next week. So the differences between an MBGT leader and other interpersonal focus groups, there's no interpretation of the unconscious processes that occur. You're focusing less again on the actual what's happening as opposed to what could be happening and increasing curiosity, lessening certainty in some ways. You're limiting any interpretations about the group as a whole, since that distances ourselves from being able to mentalize our implicit and explicit states of mind or somebody else's implicit or explicit states of mind. You're facilitating style, you're authentic, you're an active member, you're a non-expert, curious, and taking a not knowing presence. This isn't like aloofness. This is just like you being able to speak in a way that's kind of positing some curiosity with different members. So if you're saying something like, I might have this wrong, but I wonder if what you were experiencing in that moment was a sense of like disappointment in that. Like I imagine that's what I might have felt. So you're kind of like giving that space for clarification, like with the client, as opposed to saying like, this is what you feel. Like, I bet you were disappointed. There's just more of that openness to being told you're wrong. And actually, like if you're told you're wrong, which you will be, that's actually wonderful, because then you can take that in stride and have that be something that you can be open to responding to. So you kind of set a culture where we can be curious, we can fantasize or imagine things that are going on in one another's mind and be wrong, and that's fine. We're not going to go into that state, which is what most clients start at, where they're in group in which they're afraid to say anything that will hurt. They imagine that somebody will be hurt, and if they say something like not even like demeaning, but I'll use an example that I commonly do in groups, which is just to ask, who are you feeling most connected to or least connected to in the group at this point? And having them choose and really pushing them to choose one specific person. Whichever choice they make, it doesn't really matter. But the plight of what will happen when you put that choice to someone, that forced choice, will be the anxiety, the fear of disappointing someone if they don't choose someone as the most connected, or singling somebody out as the least connected, and how I imagine they'd feel awful about that. And by awful, again, I would clarify what emotion is that. They'd feel maybe left out or disappointed or guilty about something they did. When again, understandably, sometimes we're not going to connect with people as much as we do with others. And even with the most connected person, we can often worry about how others will react. And that's part of this group process, is we can challenge that belief by having other people speak to their experiences. So focusing on this curiosity, as we've talked about before, and as a facilitator, you really want to make clear what your mentalization process is like. So you're being very explicit, transparent, and understandable. You're not trying to get into a very psychobabble expertise stance, because they talk about this in the book, and it's kind of a interesting paradox when they say if you're certain about what's going on in the client's mind, then you're not mentalizing. And so mentalization is kind of that continued openness to curiosity and not knowing what's actually happening and taking place. So very counter to what I think we all are thinking about being in this role. We want to be an expert. You want to feel the safety and comfort. But that paradox is actually pretty great if you can embrace it, because if there's no more pressure to not know what's going on, then you actually don't have a lot to worry about, because then you're able to just be with your experience authentically. And that's kind of what we're encouraging our clients to do. In a lot of sense, mentalization is a way for us to be more mindful with our experiences. I think it's said in different terminology in different ways, but it really highlights that authentic here and now experience of what's in your mind and your process is fine and okay, and may not be accurate to another person's subjective reality, but it's your subjective reality, and you can have that, and that's okay. Even in the sense of making a mistake or giving a microaggression, part of it is having less of the pressure of perfectionism or needing things to be perfect or to never cause harm to anybody else, in knowing that you're going to make mistakes, you're going to say something that's hurtful. But if you hold on to that openness and curiosity, noticing and owning the impact of what you've done and growing from that and having that inform you, then that's meaningful. You being able to witness that pain and maybe the anger or sadness and hurt underneath the anger that somebody's sharing with you in that. So again, as a facilitator, you're really trying to have this very active flow process throughout the group, rather than sitting back. And I know sometimes in counseling center groups, we talk about when the group gets going, you can really sit back and just let them do their thing. That's really hard to get to that stage. I think you can have plenty of things go like in colloquialisms and like polite conversations. But when you think about mentalizing and not mentalizing, and excessive storytelling and other things that can happen, you really have to be active in this style and stance, which is maybe why I'm like attracted to it, because it gives me an excuse to jump in there. But other things just to kind of talk about facilitating from this MBTG stance. You're having that technique that they use called stop, rewind, and explore. And so that's basically when somebody gives a narrative in the group, and the narrative appears to be like feeding into non-mentalizing processes. Like someone shares a story or a narrative that seems to be kind of excessive with details, or they're kind of losing the thread, then you can stop what's going on. You can say, let's rewind to this point because I lost, and just be honest, like I lost the thread. I'm not sure, feel very like disconnected from like the experience because I don't know what you're thinking or feeling during this process. You're just kind of telling us the details of everything. So can we explore what happened to you as you were approaching your home for that family dinner? Like, what were you feeling like as you were anticipating that conversation with your parents, as opposed to just talking through the details of it? In group, when we have co-leaders for this, it's pretty cool because in this kind of style, they want you to be able to question each other actively, be curious, and explore what your mentalization processes are with one another. And being able to show the group that you can disagree, and actually that you can be convinced of something different. So if one of my co-leaders in a group had talked about mentalizing this state of mind of one of the members who was experiencing some really strong frustrations around being given a comment about her body image. And it was a compliment that she was getting from somebody she hadn't seen in her hometown for a long time. So she is a white female, I believe, who had just said, I felt really frustrated at this guy who had said, oh, you look really great, or like you've really held up well, or some kind of compliment. And I asked, like pretty instinctively, like, oh, well, what was problematic about that for you? Now there was part of me that was curious about to clarify like what feeling she was having around that, because I think in her initial statement, she didn't actually say a feeling word like I might have just said. But there was also a part of me that didn't fully recognize like the impact and the disgust or frustration at that. And my co-leader at the time was like wonderful in being able to step in and say, you know what, I'm feeling really frustrated, like hearing that, Vinny, that like maybe there's things about like being a woman and not being seen as an object that you don't have as a lived experience, that you're not getting. Like that a compliment like that is like double-edged in that it still hurts, it still cuts and says like you're only worth your body, and that's not okay. And that's something that in the group I could model and say like, you know what, I think you're right. Okay. There's a part of me that like wanted to clarify that, again, emotional affect piece, but there's a part of me that didn't jump to that in my mind. And like by having that experience and being open, like I can change my view of that, and people can see that it's okay to like have something corrected, or to have a part of your mentalization process challenged. That transformation still has to come from within me, right? I still have to accept that. So in my view, like I wouldn't see this as my co-leader changed me, but that she provided me this perspective, and I was able to integrate that and say like, yes, like I trust this person. I know they care about me. I know that they want the best for me and this group. And so I can take in that message and say like, this is important. I can honor the pain that I'm seeing that I've caused with this microaggression with diet culture and misogyny, and not personalize it as, oh, I need to defend myself. I need to clarify like what I meant. So that's like really the beauty of having like a co-leadership in this dynamic, is you can have really wonderful moments like that. We want to be mindful again, like within this space, as well as like the level of arousal for people in group, because as you're going through the group mentalization is a nice way of just thinking about it from the space of who's over-aroused, who's under-aroused, and how can you integrate them with interventions so that that keeps it an optimal level. So it's like that optimal stress level curve in some way, in which you're always trying to find a balance. So if somebody's overstimulated and they're really overwhelmed at a topic that's happening, sometimes you have members who they say like, I just can't talk about this anymore. Then I might mentalize, have other people mentalize, what do they think so-and-so is feeling like as they're sitting with this pain or this like the emotions that they're having right now. And people will be able to say like, I think they're feeling really like hurt or frustrated maybe at the group leaders, like continuing to ask them questions, like you haven't given them a break this entire time. And so being able to kind of have that break from them speaking, but having other members be able to speak to their process, speak to their inner mental like emotions, both gives the benefit of them being able to maybe validate and empathize their experience. They're kind of clarifying their affect in some ways that they couldn't speak to, while also giving that person a break from the spotlight by having other people do the mentalizing work for them in that way. So you can also ask like kind of what happened or what took place that led to this person feeling that way. Like if we were to stop and rewind and explore what got us here by doing that with the other members and letting that person kind of stay to the side for a bit. So monitor the ability for each member to mentalize, to take perspective, to not be as certain with their views, and speak to their internal states as well as the potential external states of others. You want to also monitor for any nonverbal indications of emotional responses, head nodding, smiling, revulsion, what have you, when someone's talking. You're kind of, again, like this active floor manager or dinner party host, so you're looking around to see who's somebody that you can bring into that. And then you utilize strategies, which we'll talk about in a second: triangulation, parking, and pausing. So as I've kind of said, I think this kind of goes over things before that have been noted, but you want to have authority, be in control in terms of like keeping an active presence in the group, but not authoritarian, inviting people in, being gentle, using humor, and being open and authentic with your experience, as well as modeling your own mentalizing openly with people. And yeah, just be aware of like dismissive statements that could be the stereotypes, absence of curiosity, generalizations, excessive details about events, or behavioral changes that occur within the group. You really want to just foster this culture of inquiry, where, again, we can all be in this curiosity together. And that really breeds connection in a lot of ways. So the hierarchy of interventions that they'll go through, and we'll go through these kind of quickly because I recognize the time's coming. Hierarchy of interventions, like empathic validation, which is really like approximating what emotions somebody might be experiencing in that. And again, culturally, this can be very dependent, and people may not have the language for specific emotions. So I have a whole thing I could talk about on emotions, which we could speak to later. But this feels important to be able to empathize with what the experience is so that you can build up epistemic trust. So you can be wrong, but being able to pause it, like, I think what you might be feeling is disappointment or embarrassment, because I've felt that way when I've been rejected by like a loved one. Then that can be really meaningful, and they can validate that or kind of shift it depending on what it means for them. Recognize again, though, like with my international students within like the dissertation process group, there's people that have a very difficult time because it's just not part of that cultural upbringing to be like naming those kinds of emotional experiences. And they speak more about their thoughts. And so using somatic processes to name like how you're experiencing things, or just allowing them to speak their thoughts and to name what you think that means for you. Again, not saying yours is better or correct and yours is wrong, is really meaningful. clarification of what's happening and what's the problem, or what's their mentalizing process or someone else's mentalizing process, exploring that. Affect identification and affect focus, so like focusing in on those things like we had mentioned just a minute ago. And then mentalizing the interpersonal relationships within the group and with the group facilitators. So clarification is clarifying the markers of the narrative. So you do have to go back to there and then have them speak to their experience, increase their curiosity through the different perspectives of the antagonists, protagonists, or other people within the story. And the goal is to assess how much can you stimulate their self-focused mind or their other-focused mind, and be cautious about slipping into these teleological modes, looking for concrete solutions. And if you get into this over-detailed talk, that's typically hiding anxiety and just being able to name that. So circling around a topic of storytelling, even just to say, like, I don't mean to cut you off, but could we get to the main points of the story? And then that way, the group and I can consider some things with you and we can reverse and go back. So that's something helpful that can be really good to not have people drone on. And then if there's all these monologues from people, they use a very strange example in the book of a dead cat process where 3 people basically talk in monologues about their cats. And so they're all talking about a shared topic, but they're speaking about their own experience with having cats that have passed, with no interest or curiosity into each other's thoughts, perspectives, or connecting with their emotional experiences. And so not having that occur when you're going through that. Some other pitfalls in mentalizing: don't have it be an individual therapy dynamic where you and the person are going back and forth while the group watches. There's some exceptions to that, like when you're first getting into a clarification of a narrative or story. But once that starts happening, you want to bridge other people in and speak to like that through triangulation or other methods. Recognize the hesitance of members so that you can focus on who is engaged and who is not engaged in the sharing of these vulnerable details, given the various identities in the group. Again, you don't want to take that for granted, that certain members may be harder to share like aspects of themselves openly, and not to have that be an expectation that has to be fulfilled or that they're doing something wrong by being more cautious given that space. Again, I think it's helpful to name those dynamics and the identities that are present in the room. This idea of like, I don't want to draw attention to it if there's only maybe one like Black identified member or one member of specific gender. I think it doesn't go away by not talking about it. So we want to mention it up front and lean into that to give permission that that could be something that's at play in this. So facilitators, as facilitators, you may lead into answering the questions for the group and mentalizing for them. You want to avoid doing that. And you want to highlight if there's rapid interactions that seem superficial or like, implicit assumptions are kind of being made about the people in the story by stopping. How did we get here? I might have been missing something, and backing up. So essentially, triangulation is the thing that we would do a lot with bridging. Whereas like if you have 2 people in a dyad talking, you ask a third person, what's your view on this discussion? Can you help them out with the problem that they're going through with one another? Or what's your feeling listening to this? How does this make you feel about yourself? Does this resonate with anything that's happened in your life? And again, even in this dynamic, you can have one of the co-facilitators focus on who to triangulate into dyads that are talking, because dyads and pairing is a normal basic group assumption that happens. People get into back and forth dyadic conversations all the time. Whereas the other person can focus on the different mentalizing processes. You never triangulate to the group as a whole because it takes it away from the connections and focuses on, it doesn't focus on mentalizing within the group members. So just keep that in mind. Parking, that's essentially helping a person pause so that they can regulate their emotions, their affect, monitor the arousal of conversation, but recognize again the impact of who you park and what identities they hold and what that might mean like for that. It's important to recognize that, if somebody is feeling very emotionally activated and angry at, something that took place, it makes sense, again, to park them and to say like, oh, they need to cool down. But if their anger is because of a microaggression or something that's occurred in the group and it's the first time that they've shared that kind of emotion, and they have a marginalized identity if they're a Black woman, then you may have to approach this differently. You may need to speak to them and kind of ask like what's going to be helpful. Like obviously context will differ greatly on this, but being able to have them be more in this autonomous choice and not just recapitulate this idea that like, oh, well, we can't have you angry with that tone. Like we need to like park you to the side. Again, there's things that can really replay these like sociocultural narratives that we want to be cognizant of with these interventions. So focusing on parking can allow you to like return to another theme that's been present within the group. And you can kind of say like, I feel you kind of getting overstimulated. And so let me park you to the side and let's have other people do some mentalizing about what's happened or about this other dynamic that's at play, but I will get back to you. I want you to know that. And really checking in with them. Be cognizant again, who you want to park, why you want to park them. Is this their first time being safe enough in the group? And is this the appropriate intervention at this time? And remember, if you forget them and you don't go back, that's a rupture that you're going to have to repair. And so mentalizing like that potential experience from the member and how that is for them is going to be really important as well. And the last piece is siding. So that's when you actively take the side of a client that appears more vulnerable during the interaction. Again, great idea if the right context occurs for it. So if you have a representation of a very vulnerable member expressing, and by vulnerable, I mean, well, vulnerable again can mean actually very different things depending on the cultural context too. So you want to be cognizant of like, what's vulnerability actually look like for each of these members based on their history, based on what you've been able to ascertain from their background and cultural upbringing. Is overt emotional mean most vulnerable? Is somebody who's most vulnerable somebody who's experiencing white fragility in this moment and actually siding with them as opposed to like being able to focus on the first microaggressive injury that took place, going to replay this traumatization again? These are all things that I think can be really helpful to be considerate of as you navigate this. I recently had clients who were very upset at a homophobic comment that was made by one of the members, and that member was also hurt, but I stayed focused on the person, like the people with the marginalized identities first, applying the first aid mentality to them, making sure that they were feeling heard and honoring like where that pain comes from for them, and having them mentalize that before going to the person and like being able to reflect with them on that process. Yeah, and when you're co-leading, make sure to suggest that both co-leaders take the opposite side of that dyadic conflict. I think again, there's dependence on this. You don't want to do that if there's certain stimulus values that could really change the tone of what that looks like. But it's something that's an interesting consideration with co-leadership. And that's it for these references. So thanks so much all for coming, and appreciate you like giving this a go for the first session of this.